In this dynamic era of healthcare, the demand of the moment is to embrace a proactive stance towards prevention. The Health and Hygiene Council endeavours to shift the paradigm of healthcare from reactive to proactive, ensuring well-being for all. By prioritizing preventive measures, we not only save lives but also enhance quality of life, reduce healthcare costs, allocate resources efficiently and foster health equity. Preventive measures such as vaccinations, screenings and lifestyle interventions prove to be more economically viable than curative treatments. Preventive measures can significantly elevate the burden of diseases and lead to healthier populations. India's rich heritage includes holistic health practices like yoga, Ayurveda and naturopathy, which are globally acknowledged and can be harnessed for preventive health care. To realize the vision of Health for All, hygiene stands as a linchpin in averting public health crisis. In a populous nation like India, the establishment of an expert health council is imperative to guide decisions on health and hygiene. This council will serve as a vital liaison between medical professionals and policymakers, ensuring that evidence-based practices are seamlessly integrated into public policies. Doctors bring specialized knowledge to the table, aiding in the development of comprehensive strategies tailored to India's unique healthcare landscape. The Council critically evaluates research findings, ensuring that policies are grounded in the latest medical insights. Through proactive measures, the Council can help forestall the spread of infections and mitigate the impact of epidemics. Insights from the Council will facilitate effective promotion of healthy hygiene practices, fostering behavioural shifts across diverse communities.
The role of the Council will be
policy formulation, guidelines and standards, education and awareness, monitoring and evaluation, emergency preparedness, empowering health through prevention, identifying gaps in the health sector. With a focus on prevention, the Health and Hygiene Council endeavours to empower individuals, communities and nations to embrace a healthier future. Introducing the BSI Health and Hygiene Council members. Dr. Indira Chakravarti, Padma Shri 2014, Public Health Specialist. Dr. Praveen Chandra, Padma Shri 2016, Medicine Cardiologist. Dr. Nageshwar Reddy, Padma Shri 2002 and Padma Bhushan 2016, Medicine Gastroenterologist. Dr. Neelam Clare, Padma Bhushan 2014, Medicine Neonatologist. Dr. Dhananjay Divakar Sagdev, Padma Shri 2021, Medicine Hematologist. Hello and welcome to a World Health Day special on the Banega Swasth India campaign, where we explore key issues and innovations shaping India's well-being and delve into topics crucial for achieving healthier lives for all. The conversation that we start with our Health and Hygiene Council today is going to continue through the season of Banega Swasth India, through regular interactions with the Council, as together we find solutions for how to future-proof India's health and how to drive lessons in good hygiene as the bedrock for good health. By the end of the season, we hope to have ready the Council's first white paper, a simple action plan that will be one step forward in answering the question, how do we make India more healthy, more aware and better prepared? Also joining us today is Ravi Bhatnagar, Director of External Affairs and Partnerships, South Asia, RECIT. Thank you all so much for joining us today, for giving us your precious time. It's a pleasure to have you as we're going to be talking about this very, very important step of launching the Health Council on World Health Day. I think to begin with, Dr. Indra, I'd like to start with you. Quickly, if you can tell us 3 to 5 challenges which you face in your field of expertise.
Ambika, I think I'll highlight those challenges for which the advance hasn't been too great. I think the most important public health problem that we have today is diarrhea. if you look into the data over the couple of years, you would see that diarrhea hasn't decreased at all. The NFHS 5 clearly indicates that it's actually gone up to 9.2. So therefore, this is something which is very important. Moreover, diarrhea can be much more aggressive to, for example, children with AIDS. They have 11 times more chance of mortality compared to any normal diarrheic child. So therefore, these are issues which needs to be really looked into. The next most important thing that I think is undernutrition. That's another area where we have not been able to succeed as far as we wanted, especially in children, also in women. And as you know that India now hosts nearly 1/3 of the global undernourished children. Very high numbers, high stunting, underweight. I'm not going to statistics, more than 30%. So these are areas we really have to look into. I'll call out anemia, though it's a part of undernutrition, because anemia is so very important. If you look at the statistics of anemic women, anemic children, anemic infants, I think Dr. Neelam will agree with me, they vary from 60 to 70%. Okay. So that's a huge problem that we have here. And I think the reasons are multiple. Sure. And so it's not just a health issue, it's something else. So I think anemia is the third thing that I think is extremely important. The fourth thing that I think is women's health. Women's health is something that we have been neglecting a lot. I think the first reason is women don't come out with it. They're shy about it, they don't want to say. Look at the anemic women that we have in the country. Look at the menstrual hygiene. I mean, it's so important for women's health, but women don't come out of it, and family and community is not really aware. They're shy of the whole thing. So I think this is something, women's health is something which is extremely important to me as a public health problem. And lastly, though it's not really a public health thing, but acute respiratory diseases. Okay. They are the highest killer disease in the country, and as we know, it transmits very easily. You have the pathogen, the droplets on your hand, and that can easily transmit it to one person to another person. During COVID, we found how quickly it transmits. So I think ARI is another, the fifth thing which I think the country has to look into.
और इस पे और काम करना बाकी है.
And find out the gaps.
And I think जो आपने कहा अंडर न्यूट्रिशन, मैल न्यूट्रिशन, अनीमिया, इस पर मैं आपके पास आना चाहूँगी डॉक्टर सखदेव. आप इसी पर काम करते हैं और बहुत एक्सटेंसिवली काम करते हैं इंटीरियर्स पे. आप बता सकते हैं वो क्या चैलेंजेस हैं जिसको आपको लगता है एम्फोसिस होनी चाहिए, उस पर काम करना चाहिए?
अभी वायनाड में भी देखेंगे और ऑल इंडिया में भी हम 5 problems we see that it should be properly tackled. First will be iron and anemia. It includes this iron deficiency anemia and sickle cell anemia. Second will be what she was studying about hygiene. Third is malnutrition. Fourth is tuberculosis. It continues to be a major health problem. Yes. And now major health problem is this alcohol and drug abuse. So it is critical that we look at this problem as well. Yes, okay, that's I think a very important point which I think we weren't thinking at that point. If I could come to you, Dr. Reddy here, what do you think are those challenges?
In addition to all that has been said, another very important thing that's happening very paradoxical in our country is that as we are controlling infectious diseases, better hygiene, your campaign did a great job in hygiene standards and all that. We are getting into so-called westernized disease. This is non-communicable disease, they're called. NCDs are becoming more common. Yes. For example, in gastroenterology, we're seeing a large number of fatty liver disease. 30 to 40% of Indians, adult Indians have fatty liver disease, which is extremely high, 30%. So you see, and that leads to cirrhosis liver, cancers in the liver and so on. Similarly, I think Praveen will tell you about the cardiovascular disease. So we are having a lot of increased incidence of coronary artery disease as a part of this, and diabetes mellitus is remarkably increasing. A recent survey in Lancet has shown that 11% of Indians are diabetic, and about another 12-13% are pre-diabetic, which means 25% of the population is prone to this. So these non-communicable diseases are becoming extremely important, and I think as a nation, as we start looking at controlling what is conventional, ये भी देखना कि नॉन कम्युनिकेबल डिजीज में क्या हो रहा है, उसके लिए भी कंट्रोल्स आना पड़ेगा. इट्स वेरी इंपॉर्टेंट. आई थिंक दोज आर आल्सो वेरी वेरी क्रिटिकल पॉइंट्स व्हिच यू ब्रॉट आउट, डॉक्टर रेड्डी. डॉक्टर क्लेयर, अगर आप हमें बता सकते, क्योंकि बच्चे, आई मीन दैट्स वेयर यू नो हेल्दी मदर इज व्हाट लीड्स टू बर्थ ऑफ अ हेल्दी चाइल्ड. बच्चों के बारे आप न्यूनेटोलॉजी में काम करते हैं, उसके बारे में बताइए क्या वो 5 challenges हैं which need to be addressed.
So I'll start with the newborn babies because वहाँ पे हम अपनी life को start करते हैं. तो health of a newborn is dependent on the health of the mother. Yeah. And as we know that bringing down neonatal mortality is one of the very important issue if you want to bring down the under 5 child mortality, which is like one of the markers of health, that if we can bring down the under 5 child mortality, that's like, you know, we've really done a socio-economic development.
Yes.
So as we know that we have the double burden. We have on one side, we have undernutrition, we have stunting, we have iron deficiency anemia, which leads to low birth weight and which leads to prematurity. And low birth and prematurity, if they go into the phase where they become overweight, then they are more prone to develop insulin resistance and diabetes. Okay. And as we are seeing that in young women, we are having now, you know, the age of marriage is getting delayed, they are getting more obese or overweight, and hypertension and diabetes is appearing early. So that is also affecting the health of the newborn baby. Then we have on the other side, we have the challenge of unsafe water, hygiene and sanitation, and women are more at risk of sepsis, UTI, and then these babies also are at higher risk of sepsis and dying. So it's like a life cycle. If we have to improve the neonatal survivals, we have to bring down the neonatal mortality, we have to ensure a healthy mother. A healthy mother who has access to safe water, sanitation, hygiene, she's less prone to develop infections. She's eating the right food, she's less prone to both under and
overnutrition. So the link, I think you made that very clear, how we need to work for the mother and child. Lastly, Dr. Chandra, आप क्या कहेंगे? Especially because heart is something which जो preventive तौर पे देखा जाता है, we can take care of our heart, we can take care of our heart. So tell us about that.
कि देखिए हार्ट जो है वो जैसे कि माना जाता है बॉडी का इंजन है, और हार्ट की जब बीमारी होती है तो वो एक्सट्रीम मैनिफेस्टेशन होता है, विच मीन्स इट कैन लीड टू डेथ. तो इसका मतलब ये है कि हार्ट को बहुत ही बचाव की ज़रूरत है, उसको बहुत प्रिवेंट डिजीज़ को, हार्ट डिजीज़ को प्रिवेंट करने की ज़रूरत है. वो इसलिए क्योंकि करीब करीब 70 से 80% लोग जिनको हार्ट डिजीज़ पहली बार होती है वो उसी में उनकी मृत्यु हो जाती है, यानी हॉस्पिटल तक पहुंच ही नहीं सकते. तो अगर ऐसे लोगों का प्रिवेंशन किया गया होता, ऐसे लोगों को पहले ही जान लिया गया होता, तो उनकी शायद ये अनटाइमली डेथ नहीं होती. और प्रायः हम लोग देखते हैं, बड़ी कॉमनली वी सी ऑन टेलीविजन और इन द न्यूज़पेपर दैट समबडी डाइड एट अ यंग एज विदाउट एनी प्रीवियस हिस्ट्री ऑफ हार्ट डिजीज़. सो इसका मतलब ये है कि वी हैव टू आइडेंटिफाई पीपल इन द सोसाइटी who are at risk of developing a heart attack or heart disease. तो ये चीज़ की स्टडी हो चुकी है और काफ़ी अच्छे तरीके से इस पे तो बहुत सारे रिस्क कैलकुलेटर्स भी बन गए हैं, जिससे कि आदमी ये कैलकुलेट कर सकता है कि उसको हार्ट डिजीज़ होने की कितनी संभावना है अगले 1 साल में या अगले 10 साल में. एंड दिस इज़ नोन एज ASCVD रिस्क कैलकुलेटर. और इससे हम लोग जो नॉर्मल लोग दिखने में हैं सारे लोग, उनको हम आइडेंटिफाई कर सकते हैं कि उनमें क्या रिस्क प्रिवेंशन और कैसे करें. तो मोटे तौर पे 5, जैसे आपने पूछा 5 क्या मेन फैक्टर्स हैं, 5 फैक्टर्स हैं हार्ट डिजीज़ को प्रिवेंट करने के. हाई ब्लड प्रेशर, डायबिटीज़, हाई कोलेस्ट्रॉल लेवल्स, स्मोकिंग एंड लैक ऑफ एक्सरसाइज एंड फैमिली हिस्ट्री. तो यानी अगर किसी के परिवार में 50 साल या 55 साल से कम उम्र के किसी को भी हार्ट की प्रॉब्लम हुई है, इसके मतलब उसको शुरू से प्रिवेंशन करना होगा. दूसरा, अगर कोई स्मोकिंग करता है, डेफिनेटली हार्ट डिजीज़ होने की संभावना है, उसको अपने स्मोकिंग को रोकना होगा. तो स्मोकिंग एज सच आई मस्ट से शुड बी प्रिवेंटेड, यानी कि कम्प्लीटली इसको नहीं होना चाहिए. तीसरा, ब्लड प्रेशर कंट्रोल. करीब करीब 70% लोगों को, जिन लोगों को मालूम होता है ब्लड प्रेशर उनको है, उनका ब्लड प्रेशर कंट्रोल नहीं होता, क्योंकि वो उसको टेस्ट नहीं करते. टेस्ट करते हैं तो उनको लगता है दवा खानी पड़ेगी. तो ये सारे चैलेंजेस आ जाते हैं. और हार्ट, इसीलिए हाई ब्लड प्रेशर को साइलेंट किलर माना गया है, क्योंकि किसी को पता नहीं है. जैसे यहाँ इतने लोग बैठे हैं, किसको मालूम कि उनका ब्लड प्रेशर कितना है, अनलेस सेंट्रल चेक ना करें. तो सिंपल मेथड्स इन लाइफ विल प्रिवेंट अ हार्ट प्रॉब्लम. और ये माना गया है कि अगर डाइट कंट्रोल करें, एक्सरसाइज करें, ब्लड प्रेशर कंट्रोल करें, शुगर कंट्रोल करें और कोलेस्ट्रॉल चेक करें, तो 80% ऑफ हार्ट डिजीज़ कैन बी prevented.
Prevented, okay.
More than that,
So
without any medicines.
Okay, so I think prevention rather than curative approach, and I think that brings us to the first part of the council when we've looked at the challenges. Ravi, I want to come to you here before we take a quick break. The concept of Amrit Kal, if I can just ask you about this, obviously it symbolizes auspiciousness, optimal timing. How do you perceive, a campaign like the Banega Swasth India campaign, which is in its 10th year, how do you perceive the impact that it can bring on public health and the outcome?
Very interesting question, Ambika. First of all, thank you so much for having me here. And what I see is like the scaling up of our programs from 10 aspirational districts a decade back to actually covering all the aspirational districts, which are 100 plus in India. We are in one of the toughest geographies. We are in all the 7 bordering countries, neighborhood districts where we are there. And by the virtue of our program, we have been able to reach around 30 million kids in the last year itself through our programs. The dreams are big, and we believe in the foundation of leaving no one behind. And when I say this, it means like maybe it's LGBTQI plus populations, maybe it's indigenous populations, maybe it's mothers, maybe those who are ultra poor, maybe those who are difficult to reach, working with all the segments. And as the time is changing, and this Bharat is not same Bharat, this India is not same India now. There are a lot of changes which are very positive in nature in terms of our infrastructure, in terms of the growth, in terms of our GDPs. This is the right time actually when private sector starts working with the public sector, with the caregiver groups, and working on the foundation, which I say it's a framework which will be prevent, promote and treat. Prevention is amazing, but sometimes you need treatment too.
Yes.
And to complete the continuum of care, it's important to screen early, inoculate, immunize, referrals, right treatment, and how we make it more faster. It's a huge journey for us, and on this World Health Day, I can commit one thing, like, from Dettol Banega Swasth India, we are going to present our recommendations together.
Yes.
So that some of those recommendations can be used nationwide.
Okay, well, on that note, thank you so much, Ravi. On that note, we're going to be taking a really short break. When we come back, we're going to be asking our doctors, how will the Health and Hygiene Council make an impact and what should be done for this collaboration? So stay tuned. Welcome back. You're watching a special on Banega Swasth India on World Health Day. Dr. Reddy, I want to start with you here, looking at solutions or how the council can help. The first thing I want to know is, now we have the awarded, recognized doctors here today with us across all disciplines. How do we begin a process of effective interdisciplinary collaboration? Yeah. How can the council come in here?
I think the council is important in the sense that we are separated. We are very independent. We can actually decide what is there in the scientific literature, take out what are the things that are going to benefit the country, and independently, not pressurized, we can actually give advice. This interdisciplinary council is very important because you can see the problems are not single specialty. You have pulmonary problems, you have gastrointestinal problems, cardiac problems, problems with neonates, babies, maternity health and so on. So we could all come together, look scientifically at what is happening in other parts of the world also. A lot of data that's going to be generated from this, and from this, based on a very practical view, we could give our opinions and suggest to the governmental agencies and also private agencies, and like the good work that we're having in this Swasth Bharat, we can actually give certain guidelines on what has to be done and what can be done in a country, and of course set timelines that within a certain period of time these are followed, and I'm sure this will make a remarkable difference in our overall health in the country.
I think timelines is something very, very important. What you said, of course, it has to be scientific. Dr. Chandra, आप इस पे कुछ कहना चाहेंगे? What are your thoughts जो अभी डॉक्टर रेड्डी ने कहा इस बारे में?
देखिए, ये बहुत ही इम्पोर्टेंट बात है कि कोलैबोरेशन होना बहुत ज़रूरी है, क्योंकि अभी तक मतलब ये लोग प्राइवेट वाले सोचते हैं कि ये गवर्नमेंट का काम है, गवर्नमेंट सोचती है कि ये प्राइवेट अपना सिर्फ ट्रीटमेंट करते हैं, एजुकेशन में पार्टिसिपेट नहीं करते, बट और या इंडस्ट्री जैसे कि जो इन्वॉल्व है वो भी ये सोचा जाता था कि ये सिर्फ सामान बेच रहे हैं, कोई आगे फर्दर इस चीज़ को प्रमोट नहीं कर रहे कि हेल्थ केयर एज अ पॉलिसी हैज़ टू बी प्रमोटेड एवरीवेयर. सो आई थिंक अगर ये तीन जो ये इंस्टीट्यूशंस हैं, प्राइवेट इंस्टीट्यूशंस, गवर्नमेंट इंस्टीट्यूशंस एंड इंडस्ट्री, अगर ये साथ में मिल जाते हैं और एक सोच बनाते हैं तो आई थिंक इससे ज़्यादा जो उसका इम्पैक्ट है और किसी चीज़ से नहीं आ सकता, क्योंकि इससे क्या होगा कि सोच भी पूरी बदलेगी और उसका इम्प्लीमेंटेशन हर लेवल पे होगा. एंड जो कि आप लोग भी ये कर रहे हैं कि इस सारी इन्फॉर्मेशन को और फैलाना, लोगों को एजुकेट करना, अवेयरनेस करना, वो काफ़ी इंपॉर्टेंट होगा.
आपने जो एजुकेशन और अवेयरनेस की बात की, डॉक्टर इंदिरा, आई वुड लाइक टू कम टेकिंग फ्रॉम व्हाट डॉक्टर चंद्रा ने कहा है. Bringing, I mean, education and awareness is of course key. I mean, what Ravi said, to bring about behavior change. Now, this is the most critical when it comes to prevention. You have worked in the public health for decades now. How do you think the council can help when it comes to prevention?
When you think of prevention, Ambika, I think if you think of it, the non-health issues are possibly far more important in many of these preventive factors. I mean, as you know, the Swasth Bharat or Dettol Banega Swasth Bharat has been going on for 10 years, reaching more than 110 million people across the country. And that has been one of the main objectives of the whole thing, of bringing these non-health issues into the health sector, like hygiene. We know that diarrhea is there, we know undernutrition is there, all these problems have been identified. But I think what we have not really realized that it is the water sector, the sanitation sector, eventually both into the hygiene, is the most critical thing if you look into it. That's one of the issues. It's very, very important. Therefore, India with lack of sanitation water is nothing out of the way. It is a problem, global problem. But I think with our Swachh Bharat initiatives, our Jal Jeevan Mission initiatives, we have surpassed a lot of, we've increased a lot our sanitation. Water sector has also improved from 16 possibly to 70%. So these are issues we have taken care of. But ultimately, hygiene is the crux of the problem. You can give water, you can give sanitation. But unless you maintain hygiene, it's a very difficult thing to do. Therefore, this sector, awareness on hygiene, awareness on simple things like hand washing, personal hygiene, these are not only important for diarrhea, also for control of undernutrition, control of acute respiratory tract infections like pneumonia. It is very simple, simple issues. And I think that is something where we need to, even women's health, if you look into it, as I mentioned earlier, even there hygiene and sanitation is so very important. Pregnancy is a very important factor. During pregnancy, anemia is high, maternal mortality is pretty high in the country. And we don't realize that if the mother is not healthy, as Dr. Claire mentioned, the child who is born will not have proper cognitive developments, will not have proper physical growth. So I think the whole thing has to be linked to these non-health issues more
that's a very important
than you do
point.
Into direct treatment issues. I think that's the most critical factor.
So prevention, you feel, non-health issues, and hygiene of course plays a very, very critical role.
I think that's the most critical factor. I think that's what Banega Swasth India has been trying to force into.
And that's what
years.
We want to do with this council, and thank you all once again.
Has to take that forward to the target.
Yes, in fact, we're really grateful for all of you to come here and speak to us about this critical issue. Dr. Claire, each doctor here, we have some of you here and some of you will be joining us for the white paper formulation as well. Each doctor's vision for how we can future-proof India. Can you give us 2-3 immediate or definitely things that should be put on the white paper which will make an impact?
Yeah, I think the most important thing which comes from the council, which should come from the council, is the health education.
Okay.
Because, there are a lot of things which we know, but probably still we don't do. And as Ravi very rightly said, that behavior change is one very important area. Like, we know that open defecation is wrong, and it leads to water contamination, and it leads to the waterborne diseases. It leads to diarrhea. There are so many diarrheal diseases, diarrheal deaths. It leads to pneumonia. It leads to all kind of infections. There is, children can't go to school. They have to take leave. But still, we've not been able to bring it to zero. We built the toilets, but still we could not change the behavior of the people. So probably health education and behavior change is something on which we'll have to work when we talk about the wash, we talk about clean water, we talk about hygiene and sanitation. I think behavior change is one area where we should really work. Second is screening of certain diseases. I think that is something, you can screen early, and, one of the areas is like, the cancers, like cervical cancer. Screening is very important. Vaccination with HPV vaccine in the young children in the age group of 11 to 13 years is very important for the prevention of cervical cancer. And again, then screening of the young mothers during the reproductive age is another area. Then there are certain inborn errors in there are diseases, there are lethal diseases or diseases which if treated early can have better impact on the health, which is called as newborn screening, which few states in India have started doing. And there are a lot of corporate hospitals which are doing. Like in the tribal areas, we've started doing the sickle cell anemia screening. If you're a carrier and if you marry another carrier, then your child has a chance of having the disease. And we've already done survey and we found that there is increased risk of sickle cell disease, and it's a bad disease. Thalassemia is another. So there are a lot of
screening plays a key role along with behavior change.
Promotion of health, early diagnosis, early treatment, and probably for that the Health Council can come up with a white paper in each area, whether it is mental health, it is reproductive health, it's infections, it's cardiovascular, or it is
absolutely. I think that is, I think, really this is what we want to do, and that's why we need your help. Dr. Sagdev, grassroots की अगर आप बात करें, where can the council's advice really bring about a change? What difference can it bring about?
अभी सिकल सेल डिसीज का जो ऑल इंडिया प्रोग्राम है
जी,
हमारे प्रधानमंत्री जी ने बताया कि 2047 तक वी हैव टू कंट्रोल सिकल सेल डिसीज, बट फॉर दैट वी शुड हैव होलिस्टिक अप्रोच हाउ टू गो अबाउट इट. फर्स्ट मोस्ट इम्पॉर्टेंट थिंग इज देयर इज नो knowledge or awareness about sickle cell disease is very poor. So even if the screening tests are now organized by government, but the man who is doing the testing, he is not aware what is sickle cell disease. Because I am telling from my experience, now government is doing in Wayanad also, they are going to the colonies and doing the testing. But the patient then they are giving card and then they forget about it. Then they don't know what to do. Then they come to me, then this type of, I have been told that I am sickle cell disease, what to do. Then we give them counseling. So that is most important, awareness of the sickle cell disease to be told to the community. Then what she said, screening of the whole population, neonatal screening is most important. And then to prevent the birth of new sickle cell, that is the pre-marriage counseling.
Okay.
That is the most important thing which should be done. Otherwise, this program will not be successful. Because in screening, we get this sickle cell disease patient, then carriers. Only 1% is sufferers, but 25% are carriers of sickle cell disease. So they carry one gene, but they don't suffer from the disease. That gene, if two people, husband and wife, have got one gene, that will be transmitted to their children. And new sickle cell disease will be born.
Very quickly, why do you think, after 10 years of the campaign, why do you think there is a need for a dedicated Health and Hygiene Council? I mean, how can they contribute, or how can this council contribute towards improving healthcare, whether it comes to accessibility, the quality of better healthcare for individuals as well as communities on a whole?
We want to promote the idea of my health, my right. And rights come with a lot of responsibilities. And moreover, like, as sir rightly mentioned about the counseling services too, that's also a very important agenda, like how, because you are doing the health education, it's important to give the right place to the counselors too in the system. Because doctors are overburdened. You see the ratio of doctor to the patients. It's really skewed. It's important to have a cadre of counselors who support the doctors, who can do the follow-ups, who can take the follow-ups and give the right direction. As well as, like, nowadays we talk about Vasudhaiva Kutumbakam, also some of the good practices from India, which are being, which will be formulated by this council on health and hygiene, will definitely travel across the globe. We need to be prepared enough to look everything from the lens of climate. Like earlier we have been seeing from the lens of gender, from the lens of women, from the lens of rights, from the lens of entitlements, from the lens of economics. This is the right time we start looking at the lens of technology as well as from the lens of climate change.
Yes.
Because the heat strokes are increasing, the climatic conditions are changing. There is a change in the vector cycles for the dengue and malaria mosquitoes. There are a lot of other changes what we are witnessing.
डॉक्टर टेटी, बहुत लिंक है हाइजीन का और गट हेल्थ के बारे अगर हम बात करें, एनीथिंग यू वुड वांट टू ऐड टू व्हाट रवि सेड? क्योंकि अगर हम गट माइक्रोम की बात करें, आजकल इतना पीपल हैव सो मेनी हेल्थ इश्यूज बिकॉज ऑफ गैस्ट्रो.
Because actually this is very important what Ravi mentioned about climate change and health. We used to as doctors think, how does it bother us? ये तो हो रहा, how are we, the petrol, cars, this thing and all. But statistics have shown that the hospital industry is the 5th largest contributor to climate change. 5th largest. Can you imagine?
Oh, wow.
So it's not just the aeroplanes, the flights and all that. So now how are we contributing? I think there are a lot of things happening in hospitals in terms of what is happening in the ICUs, surgeries and endoscopy units, and also we are generating a lot of this carbon footprints, especially the hospital waste. Hospital wastes are major contributors for this. So we have now seen that if you can actually control the hospital waste and other things, you can actually drop down the climate change. And in the UK, for example, 2050 they have put zero carbon from the hospital as a date manline, and hopefully something that will happen. We can advise on that. And of course we know that climate change produces a dramatic difference in the gut microbiome, and we know that the gut microbiome controls everything in the body. There are 100 trillion bacteria, much more than the bacteria cells we have, regular cells. So we are 90% bacteria, 10% human beings, all of us. And bacteria control what we eat, how it gets digested, even the cardiac attacks. For example, there is evidence now that certain hormones produced by this bacteria can induce heart attacks type of thing. So all these are there. So gut bacteria changes with climate change, especially with hygiene, water and so on. So it's also very important that we maintain what was there in the environment earlier. Otherwise, we're going to pay a catastrophe.
So I think environment is going to be playing a key role. I think we are all on the same page. I mean, you are all on the same page on that. Dr. Claire, would you like to add anything when it comes to mother and child, especially again hygiene, environment, because it is going to be an important aspect of the council?
In context of women and children, I think hygiene plays a great role. And as we are seeing that, our environment is changing, climate change is happening, we are going to have more and more scarcity of water. So we have to save our environment and make sure that we save water, we save the planet, and we inculcate healthy habits, we inculcate healthy eating habits. And when we talk about gut microbiota, because these days everything is being attached, health and illness, to gut microbiota, then a healthy start like breastfeeding exclusively. It's one gun with which you can kill so many diseases. Less risk of infections, less infant mortality, less under 5 child mortality, less diarrheas, less pneumonia. So I think breastfeeding, more and more cesareans and less vaginal or normal deliveries. Again, cesarean alters the gut microbiota, whereas a normal delivery, you have the normal microbiota, the vaginal delivery. More antibiotics, more changes in the gut microbiota, more irrational antibiotics. I think we have to get away from it. So I think healthy lifestyle, healthy diet, clean environment, safe water and sanitation, I think probably are going to make the crux of prevention and healthy life.
Just taking from what Dr. Claire said, Dr. Chandra, मैं आपके पास आना चाहूँगी कि लाइफस्टाइल की बात करें. हार्ट में हम हमेशा सुनते हैं कि prevention is better than cure. ज़्यादातर हम यही सुनते हैं. So लाइफस्टाइल के बारे में what would you like to say before we quickly wrap? When it comes to this council, what are the important points?
Yeah, so देखिए लाइफस्टाइल का बहुत ज़्यादा importance है, स्पेशली हार्ट में, जैसा आपने अभी ऑलरेडी कहा. तो क्या कर सकते हैं हम लोग, ये काउंसिल में जो हम लोग डिस्कशन करेंगे इस बारे में ये ज़रूर आगे रखेंगे कि भाई क्या क्या चीज़ें करनी चाहिए एज अ डूएबल एक्शंस. तो उसके अंदर सबसे इम्पोर्टेंट है कि अपना ब्लड प्रेशर कम से कम साल में एक बार ज़रूर चेक कराएं. ये हम लोग इस बात को रखेंगे क्योंकि इसके सबके लिए इम्पोर्टेंस है। दूसरी चीज़ ये है कि अगर ब्लड प्रेशर हाई है तो उसका ट्रीटमेंट भी करें, क्योंकि 90% लोग उसका ट्रीटमेंट नहीं करते और सोचते हैं कि दवा खाना ज़्यादा डेंजरस है और ब्लड प्रेशर होना ज़्यादा सही है। दूसरी चीज़, स्मोकिंग के बारे में डिस्कशन होगा, स्मोकिंग एज अ चेंज इन लाइफस्टाइल। देन द थर्ड वेरी इंपॉर्टेंट थिंग इज एक्सरसाइज और एक्टिविटी, वो बहुत कम हो गई है इन जनरल, अर्बन लाइफ में भी और रूरल में भी। वैसे बहुत सारे लोग ये कहते हैं कि गाँव में तो लोग अभी भी चल रहे हैं, लेकिन गाँव में भी लोगों ने चलना कम कर दिया, वो मोटर बाइक्स पे चलते हैं या कारें भी गाँव में आ गई हैं। तो इस तरीके से एक्सरसाइज और एक्टिविटी बहुत कम हो गई, उसको बढ़ावा देना है, लोगों को ज़्यादा चलने के लिए प्रमोट करना है। और चौथी बात यह है कि मेंटल स्ट्रेस, यानी जो मानसिक तनाव वाला जो फैक्टर है वो भी एक बड़ा इंपॉर्टेंट है, क्योंकि कई बार होते हैं पेशेंट आते हैं हमारे पास कि हमारा तो सब कुछ ठीक था, मैंने तो सब चेक कराया, ब्लड प्रेशर ठीक है, ये ठीक है, वो ठीक है, तब भी हार्ट अटैक हो गया। क्यों? क्योंकि उनका मानसिक तनाव का लेवल इतना ज़्यादा था कि उसने बॉडी के अंदर इस तरह के चेंजेस लाए जिससे कि हार्ट अटैक हो गया। तो ये सारी चीज़ों को अगर हम करेंगे तो संभवतः हार्ट अटैक और उससे डेंजरस जो कॉन्सिक्वेंसेस होते हैं उनसे बच सकते हैं।
जी, आई थिंक आपने जो कहा लाइफस्टाइल, स्टेइंग एक्टिव, ये सब चीजें हमें पता है, वी जस्ट नीड टू पुट इट इन आवर डेली लाइफ्स एंड ऑफ कोर्स द काउंसिल, दैट्स व्हाट काउंसिल की यही एफर्ट रहेगी कि ये करने के लिए। इंदिरा जी, अब मैं आपसे ये सवाल पूछना चाहूंगी, आप क्या वो 2-3 पॉइंट्स देना चाहेंगे जो होने चाहिए काउंसिल जो व्हाइट पेपर पे डालेगा?
Very briefly, Ambika, I'll add on to what Ravi said, that along with whatever problems we had on climate change, we have a huge change in increased pollution. That's a major change that we have. I think the third most important thing is the increase of population. The population density is going up. Therefore, more population, more environmental degradation, more pollution will definitely impact a lot on the climate change, and that actually increases in the human beings. As we know, even microbial resistance is increasing because of all this. We have anxiety, as you mentioned, is increasing in all this. So these are issues which possibly need to be controlled. The last thing I would like to say, everything depends on economic issues. And if you look into the economic aspect of this program, I think we all know that, for example, if you look into diarrhea, the percentage of diarrheic children is maximum in poor households. As you go into middle income or higher income people, the diarrhea incidence goes down. Very clear studies have shown this. As far as expenditure on health, this also, if you have a proper white paper, you can indicate what steps to be taken, the economic improvement take on. And I think as Ravi mentioned about the Amrit Kal or the Viksit Bharat, these programs, they're all very economy linked.
Yes,
for example, Amrit Kal is linked to, I think, poor, the youth. And we have more than 50% of the under 25 is in India.
Yes,
so we have a huge number of youth. Yes, so we have a huge number of youth in the country. It's on farmers, it's on women. So I think the 4 pillars that we have, which Ravi mentioned on Amrit Kal or on Viksit Bharat, will give us an economical improvement by 2047. I think we have to link it to those issues. So I think this will actually help in the government programs. We are really non-health. Those are non-health programs. But I think a white paper like this will actually support the issues that they are taking
and
up.
these issues need to be addressed critically.
To be supported through, yes.
Before we wrap, मैं डॉक्टर साहब आपसे एक सवाल पूछना चाहूंगी मैल न्यूट्रिशन पर, क्योंकि आप इतना वहाँ काम करते हैं। सिकल सेल एनीमिया की हमने बात की, मैल न्यूट्रिशन के लिए आप क्या पॉइंट्स देना चाहेंगे? आपको क्या लगता है इम्पोर्टेंट दैट नीड टू बी एड्रेस्ड विद द काउंसिल?
Yes, malnutrition actually both. It is undernutrition and overnutrition. So cities, there is overnutrition, they don't take good food, whatever is necessary. But in especially rural and tribal areas, it is undernutrition. So because of undernutrition, there is stunted growth and low birth weight, or weight will be less. So it will affect the child's growth and further progress in. So what is main is the socio-economic problems for this malnutrition. So we have to give them proper advice.
Sure.
What sort of food can be taken, which is locally available. And then we can advise them minimum things which should be taken is iron, zinc, B complex. So in which foods it is available. So simply we can say leafy vegetables and fruits and eggs, milk. So if it is a holistic approach to the malnutrition, which is addressed by the local NGOs or IAs or government service and improve their hygienic status, then all these so many diseases actually can be prevented.
Dr. Reddy, just one quick question. I know we've had a quick thing, even because Dr. Indira said, and and Ravi had mentioned antimicrobial resistant. A little word on that, because that's something we need to talk about.
This is very important because increasingly, and especially if you look at what the WHO also is stating, that because of overuse of antibiotics in our country, there is increasing antibacterial resistance that we are seeing, antimicrobial resistance from the bacteria. And this is a dangerous situation because if you look statistics now, we are getting a lot of these organisms. In fact, some of them have been wrongly called the Delhi microbe and all that, things like that, unfortunately because of that. So what we are finding is this super bugs, as they're called, are increasing in numbers because we don't have regulations for antibiotic use in our country. And one of the things the council should do or will do is to bring in strong regulations of how antibiotics are prescribed and how they are sold over the counter.
Yes.
In no other country in the world can you just go and buy an antibiotic from a pharmacy, whereas you can do in our country. This is very unfortunate. So for a lot of viral fevers where it's not necessary antibiotics are given. So not only the resistance comes, but the microbial flora is changed in the gut, and that gives to a lot of problems. So I think we should tackle this, and one of the important part of this council would be how we should tackle this misuse of antibiotics to prevent antibiotic resistance.
So I'm sure we're all on the same page when it comes to this, and like Dr. Chandra, like in fact all of you, jo apne important points kiye, getting a mental health expert on board, a pulmonologist to talk about, for the lung. I think these are very, very critical points. Ravi, any closing remarks from you? I mean, we've had the experts say it all, but anything you would like to add?
First of all, I would love to thank each one of them who are there in my panel today, as well as my leadership. I want to end with something very concrete. As we see, like you have the National Stock Exchange, where you can see like how your shares are, trading each day. There needs to be a mechanism so that the India's health can be seen each day, and that can come to our devices. And we can see how as a young India, under this leadership of our Honorable Prime Minister, how we are doing. Like a poor farmer also sees the stock exchange, a trader also sees a stock exchange. So in a similar way, the health stock exchange should come into play, where we can see the national health daily on our, some of the key indicators. This recommendation can also be a part of the broader recommendations if the, if the experts agree.
Well, as we end the show, it's clear that the path to a healthier future lies in a collective commitment to prevention over cure. With a renewed dedication, we need to foster behavioral shifts, promote hygiene practices, and advocate for evidence-based policies. We need to pave the way for a healthier tomorrow for all. That is what the Health and Hygiene Council, made of some of India's most eminent doctors, aims to do. As we said at the start of the show, this is an ongoing conversation, a collective effort at finding solutions and raising awareness to future-proof India. Make India healthy and aware. Until next time, thank you to our esteemed panelists and our viewers for joining us.